Thank you, Silke, and good afternoon, everybody. Please do let us know in chat if you have any problem with the sound or if you can't hear me. I'm delighted to be here to talk to you about where to find the money for your campaign. And I have to confess that I am not an expert in this, except I'm an expert by experience. We have been delivering Beat the Street for about 4 years now, and we've had a range of funding sources for this, everything from public sector to corporate and private sector. And over the last 4 or 5 years, I've learned an awful lot about how to make the arguments for finding the money. So in that sense, I can help you to understand what people are looking for when you're making applications for funding. So Silke, if you can move on to the next slide. Thank you. So as I say, I can't give you a long list of all of the opportunities for funding across Europe. There are lists of funding opportunities. I haven't got all of those to hand for all your individual countries, but I can give you some of the arguments that you might make to some of those funding sources. And unfortunately, I can't tell you where the money tree grows either. You'll have to go and find that for yourselves. But broadly speaking, there are 4 categories of sources of funding. The first is government, and that might be local government or municipality or regional or national government. The second are employers, and third are businesses and large corporates, and then the fourth category are charities and grants and foundations. And as I say, we've been successful over the last few years in securing funding from all of those different sources, but each time having to make a very different argument for each of those. And what I'm going to do is share with you some of that experience and how we've made those arguments. Next, please, Silke. Just firstly, before we start, I would just be very interested to know how many of you have been successful in obtaining money from health-related sources, so either public health or health insurance companies. So if I can ask you now to vote, perhaps Silke, you explain what people need to do to vote.
So I think you have the question now on your screen, and then the 2 possibilities, either yes or no. Maybe it's not an option this time. So please give your answer now, and then I give you 3 seconds. 3, 2, 1, and I close the poll. So now you should see the answer.
Okay, that's interesting. So some of you have received health funding. That's very useful to know. And then I have a second question, Silke. Can you show me that second question? So how many of you have been successful in obtaining funding from businesses, corporate funding?
Here again, you have 2 options, yes or no. And I give you again 2, 1, 0. Closed. And here you see the answer, Veronica.
Oh, that's excellent news. Okay, so a good starting point, but quite a few of you haven't actually gone down this route. So if we go to the next slide, please. But I want to go back just one step before we go further. Firstly, I just want to go through some of the basics, and getting funding is very much like selling. And if any of you have had any sales experience, you'll know that there's some good golden rules that apply to selling. The first is making sure that you're talking to the right people. Are you talking to the people who have the capacity to make the decision? And if not, can you get to those people? You may need to have a few stepping stones to get them to them, but you really need to make sure you're talking to the decision makers. And if not the decision makers, then at least the influencers, the people who can have influence on the decision making process. Do they have access to the money? And also, what is the limit of their funding? It may sound simplistic, but I've often wasted a lot of time talking to people about funding something when it emerged quite a long way down the process that they only had a limit to their delegation of funding, far too little for the project I was looking at. So trying to get a feel for the amount of funding available and whether it is down to them to make that decision is useful. The other thing is, for some of your campaigns, if you're talking about a lot of money or a campaign with multiple components, as a switch campaign with a health component, You might need to apply to multiple funding bodies, and that might mean different departments in your municipality or different people who have a different interest. So some with an interest in transport, some with an interest in health or communities. So somehow you've got to get them all on the same page, and I found a very useful way of doing this is just getting them into a room and trying to bring them together with a shared vision of what you might want to achieve. Even though they may have very different objectives, it's useful to help them see this vision of what you're trying to create. And that might be a very high-level vision, like a happier, healthier community, but getting them together and united in that shared vision, I find, is critical to the rest of that process. The other thing is, it's useful to remember, whilst money is very important, you need to make the strategic case to make sure that what you're proposing fits within their wider strategy. If you're going against the grain of their strategy, if you're proposing a program for children and they're focusing on adults, you may find it very difficult. So it's important to look at their strategic objectives, and also whether the project can carry on being funded, that it's not just going to be something that's funded and then dropped or end up costing them much more money later on than they thought it was going to. Thank you. Next, Silke. The other thing to realise is that people will want evidence of effectiveness, and perhaps for those of you who've been more used to looking to transport for funding, you may not be so used to talking to health people. And health people do require a much higher level of evidence. And the image that I've inserted here is an evidence pyramid. And at the bottom of the evidence pyramid are things like expert opinions or case studies or stories about people who've benefited. And the top of the pyramid tree are things like randomized controlled trials or controlled longitudinal studies. Health people tend to look at things at the top of the evidence pyramid before they fund it. And it's important to remember that there are these different levels of evidence that you may need to produce and substantiate. For instance, there are a lot of randomized controlled studies now that show the benefits of physical activity on diabetes, and that's very good, solid evidence. There are other pieces of evidence showing things around well-being that are perhaps more towards the middle of the pyramid, but usually with health people, they're looking for things at the top of the pyramid. They're used to this kind of language around control studies, comparing things to drug interventions. More often than not, people will want to see a return on their investment, and usually this means money. It might be money saved on a PR campaign, if you're talking to big business, for instance, or it might be money saved on things like healthcare savings. Next, please, Helka. Just starting then with local, regional, national government, let's explore a little bit what their agenda is and what are their motives. Next, please, Helka. So broadly speaking, there are several departments that you might be talking to in government. Transport, I'm going to assume that most of you are very familiar with applying for transport money, and you know the kind of arguments that you need to make there. But others are health, communities, and increasingly there is more and more money being put towards a communities agenda, particularly in this current political climate where we're looking for integrating communities. Environment, which again most of you will be familiar with, but access to nature for well-being is another agenda. You know, your parks and recreation departments may be interested in this. And then business development, the economy, what your program could bring to increasing productivity, increasing the economy and making it stronger. Next, please, Silke. So transport, I'm just going to run through very quickly, but you will know that most of their key drivers, what really ticks their boxes, are reducing congestion, improving air quality, reducing short car trips, and often active travel. But I say not always, because there are still many transport departments that I come across who don't really fund an awful lot to do with active travel. They may be funding cycling lanes, but not doing an awful lot about encouraging use of those. For transport people, it's all about benefit-cost ratio, BCR. It's a monetized cost benefit. It doesn't usually take into account that wider value for money, things like well-being and feeling good and making your community a better place to live. They talk very much in very rigid terms about the money that they can save by diverting traffic, reducing congestion. Next, please, Silke. In terms of health are much more interested, well, they're interested in two things. If you're talking to public health, it's about reducing mortality, reducing deaths, and this is a long-standing public health agenda, everything from making sure we have clean air and clean water, right the way through to making sure that we live our lives as best as we can and adopt healthy behaviours. They tend to be more interested in morbidity than mortality, and I'll come back to that point, but it's one that's often forgotten. They want to save money on treatment and they want to reduce the burden of disease on society. And there are three main ways that a switch campaign can do this. The most important one is going to be increasing physical activity levels, but reducing stress and bringing communities together also have very important health outcomes. Next, please. Communities. There is an increasing amount of evidence that shows that people who feel connected to their community have good social networks, are happier and therefore healthier. And again, a lot more evidence is emerging about this. So if your campaign can bring a community together, reduce antisocial behaviour and increase community cohesion, then that could have a health outcome in itself. Just increasing physical activity levels of getting more people out can benefit your community, and like health, it can also reduce stress and have that sense of community cohesion. Next, please, Silke. Just one last poll. This is the final one in my presentation. How many of you used health arguments? How many of you have broken down the health benefits to get your funding? So if you have, please answer yes.
The poll is open. Okay. So another 3, 2, 1. The poll is closed. And you see the answer, Veronica.
Okay, thank you. So 57% of you have not used any health arguments, but 43% of you have used health arguments. What I'd like to do is show you a few worked examples now. So just working through how you might make this health argument if you're talking to health people. Next, please, Silke. So I'm going to go through constructing a robust health argument. The most important statistic that you can use with health people is that physical inactivity is the 4th leading cause of death worldwide. It's overtaken malnutrition as a cause of death, as has obesity. It's a very important part of keeping healthy, and the evidence base around this has grown significantly in the last 5 years to show that physical inactivity is an incredibly important cause of death. Being physically active can prevent many diseases, heart disease, diabetes, anxiety, depression. And thinking back to the evidence tree, the evidence pyramid I showed earlier on, the strongest evidence is around reducing heart disease, reducing stroke, and reducing diabetes. And those are the 3 conditions that I would urge you to focus on as having the best level of evidence. But equally, the other benefits of physical activity cannot be ignored. They're very important too. The mental health benefits, the benefits for conditions like osteoporosis, arthritis, any condition that has inflammation as its cause can be improved with physical activity. And what we know also from the evidence that active travel, so the physical activity you have on your commute to and from school or work, can make up a significant contribution. For children who are active at the recommended levels, and that's for an hour a day, those who are active for an hour a day, 1/3 of their activity comes from their walk or their bike to school. So if you take that away, most children will not be getting enough activity unless they are walking or cycling to school. For adults, it's even more. So we know from the evidence, and I've got some references I can show you on this, that actually up to about 4/5 of an adult's requirement can come from their active commute. So the typical excuse for most people who are not physically active is that they don't have time. But if you can find the time by building in your activity to your active commute, we know that's a very sustainable and achievable and potentially free, not completely free if you have to buy a bike, but potentially free way of keeping active. Next, please, Helga. If you've ever worked with transport and made health arguments, you may well have used something called the HEAT, the World Health Organization Health Economic Assessment Tool for walking and cycling. And it is a very useful tool for estimating the cost-benefit and the returns on investment for health. It is quite easy and simple to use, and there is a tutorial that you can go through online. I would urge you all to look at it. And it is becoming increasingly used by transport to show the added benefits of their schemes that go beyond that typical benefit-cost ratio. The only issue with the HEAT model is it looks primarily at mortality. In other words, the number of deaths that are saved by your intervention. And actually health are more interested in morbidity, so the lives that are made better, the increased life to years. So that's a very important thing to remember. Mortality is useful as a measure, but morbidity, the reduction in the burden of disease, is more important for health. And I'll go into this in a bit more detail. Next, please, Elka. So the main three diseases for which we have the very good evidence on physical activity making an improvement are stroke, coronary heart disease, and type 2 diabetes. So as I explained, calculating the cost-benefit for health is more important to look at morbidity, so adding life to years, also adding years to life, but adding life to years, making those years healthy years is very important for health, and that's where the greatest financial gains are to be had. Next, please, Selka. I'm going to just show you through an example. So just taking one condition, in this case, type 2 diabetes, and this is the kind of methodology that you would work through to estimate the health cost savings. So you would first estimate the number of patients or the number of people in your population with pre-diabetes, and this is often a figure that you can obtain from your health department. These are people who have some of the underlying conditions that will lead to diabetes, so elevated cholesterol, LDL cholesterol levels, or high blood pressure. Those kind of figures are usually available at a population level. You would then estimate the number of participants who would become active as a result of your intervention, and this could be taken from previous projects showing the proportion of people who took up the intervention. You'd estimate the benefit of the physical activity on preventing diabetes, and I'll talk through that in a minute. You'd estimate the cost, the traditional cost of treating diabetes, the cost of any alternative treatment, and then you finally estimate the number of cases of diabetes prevented from the subsequent cost savings. So if we go to the next slide, please, Silke, I'll show you through an exact example of this that we've used in one of our Beat the Street projects. So we demonstrated with one of our projects that our initiative led to an 18% increase in people meeting the guidelines of 150 minutes of activity a week. And we estimated this from before and after questions asking people how many minutes of activity they did in a week. We had 30,500 participants in our project, and we know that they're representative of the target population. Their baseline activity levels, their gender, their age is representative of the population as a whole. We know from population data that 35% of the population will have pre-diabetes. Of these people, 5,524, so that's 18%, will be lifted out of inactivity as a result of our intervention. And of these 5,524, 1,933, so 35%, will have pre-diabetes. Of these, 402 will go on to develop diabetes, and we know that the rate of developing diabetes is about 10 people in every 100 patient years. We know that the activity will reduce the risk of that by 52%. Consequently, we know that 233 people will no longer develop diabetes as a result of our intervention. Next, please, Silke. We also know that the cost of treating diabetes in England is £2,588 per patient per year over a 30-year period. We're going to avert 233 cases costing this amount of money. That is the kind of health argument that actually has made the case for many of the projects that we've had funding from health for And that's the kind of thinking and the kind of process that you would need to go through if you were looking at making a health argument with your health departments. There are similar figures for all of your countries that are out there. The process is very similar. There are tools that have started to developed into which you can input your intervention, and it will give you these kind of calculations. At the moment, I think there are only such tools in the UK that have been developed by the National Institute of Health and Care and Clinical Excellence, but there are certainly some examples of models that have been worked. And if you wanted any advice, I'm sure that there are many academic institutions and certainly our switch partners who could help us with working out similar kind of calculations for your area. But it makes a very powerful argument for health. Next, please, Ilka. Nearly there. I just want to make the case here, and this is an example from a reference which is put down at the bottom there, that there are many departments out there that will touch on your agenda. It may be health, it may be communities, it might be education. We know there's very strong evidence that walking and biking to school can improve children's performance. So there is a very strong case, and I would urge you to always reach out to colleagues in other departments to see where your agenda may cross over with theirs. Next, please, Silke. There's some references I've put here which summarize some of the data I've just been presenting, and please do go and have a look at them. They are examples from the UK, but they are useful examples. And also that final document which explains some of the technical background to some of those calculations. We'll leave these slides for you to find, and you can follow those references. Next, please, Elke. Just very quickly, employers, and I'm sure some of you will be familiar with this. Next, please, Ilka. It's useful to understand that employers might fund your campaign, and we've got examples where we've had very good interaction with employers, not necessarily funding campaigns like the Antwerp campaign, but getting very involved in promoting it. And there's obviously a clear agenda for employers. An active workforce is a healthy workforce. There's reduced absenteeism, there's improved employee well-being. Essentially, this all leads to increased productivity, and there are some very good documents out there that help to make the argument for walking and cycling to work. I quite like this cartoon. I like the irony of it, because this is exactly what we're trying to do, and yet they thought this was funny. We are trying to encourage people to walk to work as part of their well-being campaign. More traditionally, employees might want a gym in the office, but we're saying your gym is outside your office on the way to work. Next, please, Silke. So just to look at an example of reduced absenteeism, the average rate of absenteeism per employee is 7.2 days per year. We know that cycling and walking can reduce this by 6%. Again, this translates into a very clear monetary gain, which you could put to the employer in question and suggest that they might want to co-fund your campaign. Next. In terms of business and corporate, we have had funding from corporates for some of our campaigns. Some of these also have grant-making arms to them, so there are companies out there that have a whole department dedicated to grant-making. And it's useful just to have a quick overview of their agenda. Next. You've got to remember that their agenda is predominantly about financial growth and stability. It might also be about getting more people onto the high street, and I'll come back to that one. But it's about their corporate image, about their market share, about their public relations. And a lot of that is often called their corporate social responsibility, being seen to do the right thing because ultimately it's better for business. Next. What businesses like, from my experience, is they like high-profile but uncontroversial campaigns. They want something that's far-reaching. They may want their branding, but not always, and that's important to remember. Sometimes they're quite happy to be a backseat partner and fund something with minimal branding, just so that they can make a political statement when they're lobbying their people in their area. They like programs that have a feel-good element and a high level of community engagement, and they also want a good fit with their geographical or commercial values. Next. What they want in return often is exclusivity, so they don't necessarily want to co-fund with another corporate, and they want some statistics on the reach and the impact. They're less worried about the impact. They often just want the reach. So an example here from our Beat the Street campaign, the corporates who funded it were more interested in these statistics, whether or not people would recommend it to family and friends, how many people have been involved, how many likes we'd had on media and social media. That's of more interest to them than the actual health outcomes. So it's important to remember that their outcomes, whilst they might be interested in the impact, more important for them is the reach and how many people are being reached through the campaign. Next. Of course, there are some things to consider with business. You do need to think about ethics and conflicts of interest, whether your municipality would be comfortable with taking funding from one of the big sugar or the big food kind of campaigns if you also got health funding. So you do need to think about that and weigh up the balance of that in every case. And also think about the true cost. Sometimes these companies can be very demanding and demand lots of reports. They want events, they want high-profile publicity events, and these can be very time-consuming. So it's important to be clear up front about what their expectations are. Finally, I think, Silke, one more. Another useful reference. This is making the case when you're talking to local businesses in the high street, and many of you will be familiar with this report by Living Streets, but it's making the case for investment in the walking environment, basically demonstrating that walkers and cyclists spend more money in the local high street, and it's a useful tool for you to come back to. I think that's my final slide, Silke.